The midwife arrives to prepare for the birth of a baby. Not in hospital this time, but in the mother's own home.
Hello, Mrs. Coleman.
Morning, John. How are you?
Not so bad.
Hello, Janet. Well, what time did your labour begin? What time did you have your show?
About 8 o'clock this morning. Just a minute.
Oh, dear. It's very strong now, isn't it? Going to see what position...
It's been planned for since she first found she was pregnant.
It's a nice big size dress anyway to cover it well.
She's been told what preparations have to be made, and now, between her contractions, she helps the midwife get things ready. Her husband can help as well.
Bring the water out first. It'll help.
Okay, will do.
All right, thank you very much.
The midwife has brought the special equipment needed, including a gas oxygen machine for the mother. Her doctor calls in. It's a routine visit and he'll not be there for the delivery, but the midwife makes sure she knows where he's going to be just in case he is needed. He's not likely to be called for unless there are unexpected complications.
Yes, round.
If I'm not there, I can be at home.
You'll be at home at lunchtime anyway,
Yes.
won't you, Doctor?
Yeah.
And later on you'll be back at the surgery. I'll contact you at the surgery then and they can get hold of you.
Right.
Okay, thank you very much.
I'll go. Bye for now.
Bye.
See you later.
If you'd like to keep your eye on the watch and I'll tell you what time baby's born, please.
Now they're ready for the birth of their baby in their own home.
Well, you'll have to keep an eye on those as well.
What's it like having a baby at home instead of in hospital? Here's someone who had her second child at home.
Well, it was very calm and peaceful. There wasn't any of the noise and bustle that you get in a hospital, and there wasn't any of the things that can sometimes disturb people, like the smell of hospital and the rattling of instruments and the sort of shiny, gleamy machines and everybody in white coats and things. It really was hardly like being in labour at all, because it was so quiet and relaxed.
Her first child was born in hospital. What did she think about that?
The only criticism I would have really of the hospital was after the baby was born. Although we were left with her for about an hour after she was born, she was then sort of stashed away in a nursery, and I didn't see her for a few hours, and I felt somehow it wasn't really my baby. I think if you really want to have a baby at home, you just have to keep asking and keep pressing and trying to find out who the person is who can do it for you. I know that a lot of doctors don't like to do home confinement. I think my husband was particularly concerned that that might be more risky to have a baby at home, but neither the midwife nor the doctor, even when we asked them, cross-questioned them about it, seemed to think there was any risk to having a baby at home, provided that there was nothing in your antenatal period that showed there might be anything going wrong.
But most people have their babies in hospital, especially their first babies, and sometimes it's got to be in hospital for medical reasons. This mother's being induced. Her labour has been started artificially. At this hospital, induction is only carried out for strictly medical reasons. For example, the baby may be overdue and the doctors think it's in danger, or the mother may have high blood pressure, and so on. Induction usually involves deliberately breaking the waters by puncturing the sac of fluid surrounding the baby and then giving the mother a chemical substance such as oxytocin, which will stimulate her womb to contract. A drip is used which releases controlled quantities of the oxytocin into her bloodstream, and tablets can also be given. The baby will be born quite normally.
But the doctor said it was already a little bit dilated to start with, so I must have been on the way anyway.
It's not before time, is it?
It's important to be sure that the baby's ready to be born, so she's been X-rayed. That's not dangerous at this late stage in pregnancy. There's the mother's spine. There's her pelvis. And the baby's head nicely in position. The doctors can tell from the baby's bone formation that it's ready for birth. See the baby's spine? All goes well. And here she is with her baby a few days later. Sometimes induction's controlled automatically using electronic equipment. She's in labour using her gas oxygen machine. There's a probe strapped to her abdomen pressing against her skin. This detects her contractions and also the baby's heartbeats. The contractions are recorded on a strip of paper, and the machine automatically controls the amount of oxytocin she's receiving through her drip, just enough to keep her contractions coming at the right rate.
Here, baby.
Listen to the baby's heart beating.
Yes, it always does go fast.
This little boy's birth was induced using equipment like that. What did it feel like for his mother?
I was very well wired up, so you could see the rate that the drips were going, and you could see I had a belt around my middle, so you could see the contractions on a bit of paper on a graph. So I wasn't at all worried by these contractions. I can see a lot of women would have been, but I found it very interesting. And I think Mike did as well, because you could see how the labour was progressing, because it was all sort of written up at the side of me.
And her baby was fine. There's another procedure which has to be carried out in hospital when it's necessary: forceps delivery, the use of forceps. Here's the consultant.
This often worries mothers because they seem to think that forceps are dangerous instruments which can do their babies harm. This is a pair of obstetric forceps, and when they are assembled, they really work more like a protective cage round the head of the baby. If you imagine that my hand is the baby's head, these are applied round it, and they don't actually grip it. They can't squeeze it like a pair of tongs or anything like that. So the baby is protected by quite firm steel blades, and a general pull can then be applied to the head of the baby to assist its delivery out of the birth canal, either because it has to be brought out more quickly because it's unhappy for some reason or other, or because the mother isn't able to push hard enough and it's a big baby relative to her size, but big enough, not so big that it can't come out. So these are a useful tool for the obstetrician, and shouldn't in any way harm the baby. They should help its delivery into the world and make it more safe for it. They're also often used where the baby is coming 2 or 3 weeks earlier than would be expected, and its head's very soft, and they're used here purely as a protective mechanism round the head of the baby for its birth. Another occasion where forceps are used is where one is delivering a breech. That is a baby that, instead of coming head first, is coming with its bottom first. One has to be careful here that there is sufficient room for the baby's head to come through the birth canal fairly quickly, because the whole body has been born. The head has to come out in a matter of minutes as opposed to several hours. And in order to help the head out at a fairly rapid rate, again, the protective action of forceps is very useful. They again can go round the head. The baby's trunk can be held up here out of the road by an assistant while the head is brought quickly, yet safely, through the birth canal. Normally, a local anaesthetic is used to produce loss of sensation of pain in the birth canal, but occasionally a general anaesthetic is employed.
Sometimes a baby has to be delivered surgically by carrying out a Cesarean section in the operating theatre. The consultant explains.
The operation of Cesarean section is employed occasionally where the normal method of delivery of the baby through the natural birth passages isn't safe or advisable for one reason or another. This may be because of lack of room for the baby, or the baby is coming upside down and needs relatively more room than a normal birth passage would provide. By not enough room, one means that there isn't sufficient space for the baby's head to go through the pelvic canal. This is usually looked for in the antenatal period, and if it is found that there is insufficient room, the decision to carry out a caesarean section may well be made 4, 5, 6 weeks before the baby is due. It may have to be done as an emergency during labour because of circumstances which make the continuation of labour towards a normal birth inadvisable because of lack of oxygen to the baby. It's a major operation, but not a particularly dangerous one. It involves making a cut through the tummy wall, then a cut through the wall of the womb, and lifting the baby out from the womb.
The operation's now been going on for about 15 minutes. The patient's unconscious under anaesthetic. There's the anaesthesia machine and the anaesthetist looking after her patient. Carefully, the surgeon cuts through several layers of tissue to reach the womb where the baby's lying. Now he's made the opening, and he can see the wall of the womb inside. There's not much blood. Let's look at it. Just a little more to do. Then, a few minutes later, and he's ready to cut carefully through the wall of the womb itself. That's it, in the middle there. And now he can deliver the baby. Watch. The head. There's the cord. The arms.
Oh, it's a big little girl.
The cord's clamped and cut. And now she's passed to the paediatrician, who'll give her any help she needs. The operation's nearly halfway through. Mucus and fluid is removed from her air passages, but she doesn't need any other help. She's a fine, healthy baby. That's a natural lubricant called vernix on her skin. In the womb, it's secreted by the baby's own skin as a protection. So the baby's fine. And the surgeon and his team are busy looking after her mother. Carefully, he stitches together the tissues, layer by layer, to hold them together while they heal. Now she's given a blood transfusion to make up for the blood she's lost during the operation. This isn't an emergency. It's what's always done at this stage. The wound's now closing nicely. The operation's nearly over. She'll have hardly a scar.
Well, actually, a tinier than when we started.
Very soon, she'll start to come round from the anaesthetic.
Little girl. You with us? We're gonna look at the little girl.
Sarah, just half an hour old. And here she is in the hospital ward a few days later with her mother.
I feel fine, you know, I'm very fit really, you know, considering, because I couldn't believe it, you know, even after I'd had it like that, I felt so well. You know, that when visiting, you know, in the afternoon, I felt so, a lot better, and I'm quite fit, so, and I felt like it all the time really. You know, and they kept bringing her in for me, so I was quite happy over that, because I was a bit worried, you know, at first when they said she was only small, you know, and yeah, she was 6'14", so it's,
So you very much wanted to see her to be sure that she was all
I
right?
did, yes, and I couldn't believe it was all over at all. It was smashing.
Whether babies are born by normal delivery or using forceps or by cesarean section, they need looking after. They need, of course, to be fed. Breastfeeding gives a good start in life. Listen to what a paediatrician, a baby specialist, says about breastfeeding.
There are many distinct advantages with breast milk as compared to cow's milk. First and foremost, it was naturally intended that newborn babies should be fed with human breast milk. Breast milk has special properties which help to protect the newborn baby against infection.
At least she's got one eye open. Before she usually falls asleep.
The chemical constituents of breast milk are such that the milk is easily digestible and well absorbed.
The baby's sucking actually stimulates the breast to produce milk, but a mother may need some help and advice in starting breastfeeding. Such help's given at this hospital.
Just going to fix it back on. Here we are.
Some mothers prefer to bottle feed their babies. There are good, reliable, artificial milks available. It's essential to keep the bottle, teat, and all the other feeding utensils clean and sterile so that the baby doesn't pick up a dangerous infection, such as gastroenteritis.
And I've got all my sterilising equipment in.
The feed must be made up exactly according to the instructions on the packet. Making it too concentrated can be more dangerous than making it too weak. Bottle feeds are perfectly all right for the baby, provided they're made up properly using boiled water in clean vessels.
Use 1 ounce of water and just measure 1 ounce of water on here.
Once again, the hospital staff give advice and show mothers exactly how to set about things.
And then pour the rest in very slowly and make sure that it doesn't have water to feed in.
Babies must have the right food. But there's something else they need as well, which can come with the feeding. Listen to the paediatrician again.
We must remember that feeding a baby, whether by breast or by bottle, means more than just providing the baby with nutrients. It is a time when there is very close mother-baby contact. The relationship that a mother forms with her baby and the baby with her mother in the first few weeks of life over feeding is merely the starting point of a relationship that continues throughout life. Caring for baby is much more than the prevention of infection or the provision of warmth. It is the establishment of a contact which will form a basis for the baby's future emotional development.